Here we have AP and lateral view of thoracic spine in 81-year-old with history of known carcinoma of the urinary bladder, with history of mid and lower thoracic pain. The chief clinical question was to look for any metastatic lesion. So these kind of radiographs are very difficult. We need to look very carefully, and we cannot report them in hurry. This is the most important lesson on this radiograph. What we need to see is that how is the alignment. Apart from minor scoliosis, the alignment looks normal. Then we need to look at the vertebral bodies on both AP and lateral views. The vertebral bodies appear unremarkable in the upper and mid thoracic spine, but as I come lower down, exactly where it is overlapping on the diaphragm with change of interface between lucency to hyperdensity because of the lung and abdominal organs, we see loss of definition of the end plates here at the level of T11-12. On the APU as well, when we look carefully as along the vertebral bodies, there is destruction of the end plates at the level of T11-12. So these findings need to be looked very carefully, and especially if the abnormality at the interface of the diaphragm, it might be very difficult to pick up. And also, if we look carefully, there is mild right paravertebral as well as left paravertebral soft tissue swelling, which is very evident on the AP view. When we look at the pedicles, one above and one below, they look intact, similar to rest of the pedicles. The spinous processes are well visualized. There is no evidence of any other destructive bone lesion in the visualized skeleton. There is minor kyphosis at the level of the destruction of the end plates. So based on these appearance, the chief diagnosis would be discitis, despite the clinical history of carcinoma of the urinary bladder. So what do we do next? We need to do MRI of the whole spine, including sagittal stir sequence and, if necessary, post-contrast FAT-SAT-T1 sequences to further evaluate this abnormality and confirm the diagnosis of discitis, which was done later.